Hello, this is Dr. Lewerenz at Longevity Health Institute. I hope this finds you well. We've been seeing a trend here the last week or so of a lot of hormonal dysfunction. Obviously, we focus on functional personalized medicine and look at root causes. And as most of you out there that follow me know, that we look at one of our main systems we look at is hormonal inoptimization or imbalance. And we've seen a lot of trends in, and this is typical, is hormonal imbalance, and even in younger and younger individuals. Of course, we treat men and women, so we see this in all different ages and different genders. But the thing that's interesting is this, and I want to stress to you because the rates of fibroids and also endometriosis are increasing in the nation. Statistics show this. And there was just a recent article that came out in the English Journal of Obstetrics and Gynecology, and also in the American Journal of Obstetrics and Gynecology, that actually showed that there is some very unique features and associations to certain things that create fibroids, which will also create then a lot of pelvic, endometrial, uterine, discomfort, heavy bleeding, and problems, and then put you at higher risk. So obviously here at Longevity Health Institute, me and my practitioners don't want you to be at risk. So we're going to have goals to mitigate your risk, lower your risk, but also you're here to solve issues and problems. So whoever out there has issues with their cycle menstrually, we can help you. But whoever out there has issues with heavy bleeding, pelvic pain at their cycle, or premenstrually, has heavy cycles that go 4, 5, 6, 7 days of heavy bleeding, this is an ominous sign of either endometriosis, hormonal imbalance or dysfunction, or fibroids, or maybe all or several. Okay, so the new studies that came out of that showed that there's two major associations, and you've heard me already talk about this for years, but let me repeat it. Two major associations that lead to fibroids and heavy uterine bleeding and hormonal imbalance. One is actually very common and going to happen just with aging, natural aging, but also we're seeing this younger and younger, and unfortunately because of the environment we live in, stressful environment, eating unhealthy, high estrogenic foods, and things that can stimulate an estrogen response, okay, and poor liver function just from being American and eating poorly and not detoxifying well through your liver, we create these higher estrogens, okay? Estrogen dominance is directly linked to fibroids and to endometriosis, okay? This is also further down the line linked to higher risks of breast cancer. So you don't want to be you don't want to be estrogen dominant ever. Actually, as a man, you've heard me talk about this. Estrogen dominance creates risks of prostate risks, weight gain, type 2 diabetes, fatty liver disease, increases of breast cancer, ovarian cancer. So you never want to be estrogen dominant. Now, if you already know that you have fibroids, you better get on this. So just watching them and keeping an eye on them is not enough. You need to shift yourself into getting rid of estrogens that are hanging around in your body. You need estrogens. Estrogens are good for you. Even men need a little estrogen, but you need estrogens, but you need to detoxify and get rid of them, okay? You've heard me say this before. So back to the study. There's a huge association between higher estrogens and fibroids. Fibroids, again, are bigger growths of tissue in the uterus or around the uterus or ovaries or fallopian tubes that actually can cause pain. They're more common in your late 40s, early 50s, okay? But there's a few simple steps that we can do to help you get out of estrogen dominance, and that is we can help you detoxify. Anytime you help yourself detoxify, you get rid of bad estrogens. It's what helps you lose weight when you do a detox. Okay, there's a certain things that help you detoxify. A couple of them are called DIM and IC3. They're from cruciferous vegetables. There's a few other things that are herbal that can help you detoxify these bad estrogens, okay? We also use hormonal approaches. Had a patient here that was fairly young that has had on pelvic ultrasound a couple cysts. She had been dealing with a couple years of pelvic pain, terrible periods, painful ovulation, We discovered a little bit of buildup in her endometrial lining, possibility of endometriosis, which is an autoimmune inflammatory response in the endometrium. But we've already got her endometrial canal shrunk down with a little bit of hormonal therapy and natural elimination of hanging around bad estrogens. So we've gotten rid of this estrogen dominant effect. Today, actually, I saw her on follow-up. Less endometrial lining, feels much better, no pain, and her heavy cycles are still heavy, but they're shortening down from 6-7 days to 3. Now, we're still going to follow the course and do a continued follow-up on her pelvic ultrasound, but this can same be the case with fibroids. Fibroids need to be identified by an ultrasound, but we can do natural hormonal therapies that can actually help you get out of estrogen dominance, okay? The other thing in the study that showed this too is that there's certain things in our world, toxins, that actually can make you estrogen dominant, and that is PCBs, chemicals that actually have a estrogenic influence on your body. These bicarbonates, these chemicals, these toxins, PCA, PCB, these are in plastics. They're used in the environment in fertilizers and in chemicals used to mitigate agricultural issues, bugs, pesticides, etc. Okay, insecticides. They're also found in plastics. They're also found in some bags of foods that you store food in, etc. And so these things that are in our environment that have a negative toxic influence have been shown to create a higher estrogen dominant effect, and very linked to in these two journals. Actually, again, the American and the European Journal of Obstetrics and Gynecology have both shared this study that shows that these are things that create fibroids. So again, these things can create estrogen dominance, it can create fibroids. We naturally with aging get estrogen dominant. So as we age and we get into the middle years, or mid-40s and on, women actually develop this bigger risk of negative imbalanced hormonal issues. Now, let me shift gears. Men, you don't want to be estrogen dominant either. Again, it makes you fat. If you're estrogen dominant, that means your liver is converting some of your testosterone, okay, into estrogen. It's through the liver, and this aromatization, we call it, effect can be mitigated by using some herbals and some supplements to help you get rid of estrogens, okay? And if you're on hormonal replacement therapy, and all our patients, we watch very closely your estrogens, particularly estradiol, because it's the most strong of all the estrogens. So hopefully this enlightens you and educates you. Share with others, because this is huge and it's escalating in our country, and you're going to see it. And fibroids are been around for years, but they're growing more and more. We're getting more and more younger and younger, just like we're getting earlier menopause and higher estrogen dominance in men and women at an earlier age. So watch your hormones, get them checked by a qualified provider. If you need help and you're in the area, Longevity Health Institute here and my Lewerenz Medical Center, we are actually, my practitioners, myself, are experts in this, happy to help you, happy to share the knowledge and share with others. But you never want to be hormonally imbalanced and be at a risk for things like fibroids, or God forbid down the road, an estrogen dominant thing like breast cancer, ovarian cancer, etc. So hopefully this is educational to you. Share with others. We're always here to help. A couple new things in the practice here just to share. We have a Concierge program to streamline some of our care. We've been able to connect more of the doctor-patient and provider-patient relationship a little bit better, get rid of some of the barriers with insurance and stuff. Our door then is always open and easy to come and go. Prioritize your appointments and your time. We also have a partnership with a laboratory company with our Concierge program that helps you mitigate costs and reduce costs, which helps everybody, and still you get the best of functional wellness preventative medicine at a direct primary care level. And unfortunately, just with higher deductibles and less things with your insurance being covered. We feel like this is going to be a growing trend in our country. Already seen this in studies. Actually, 5 to 7% every year of of internal medicine and primary care are going towards a direct primary care model, or a concierge, if you will, model. So we're starting to offer that now here, and it's already taken off, and our patients, I think, are really enjoying the benefits of it. As they get more streamlined care, but also a better access, more affordable care. Again, I think we need to be like the old Dr. Marcus Welby, and that's keep the doctor, the provider, patient together, and so that there's a relationship to bring you the best in wellness and prevention, and the best in medical care. So have a good evening. Dr. Lewerenz, Longevity Health Institute. Stay well.